Now we're trying to look at how occupational, like how diseases affect work output. So if you have a disease, can it be able to affect the amount of what work you can be able to do for a particular day? We're just trying to look at that possibility. So how diseases affect work outputs is what we're looking at. So let's quickly be on it. So what we have is this, of course, if you have a particular medical condition, it could actually affect the amount of work you can be able to do for that particular day, So diseases usually reduce work outputs and they impair how a patient is able to function. Okay. Common examples include respiratory illnesses, hearing loss. Don't worry, we'll look at them, right? So under the respiratory system, you can have disease conditions because you are exposed to dust, because you are exposed to fumes, because you are exposed to asbestos, because you are exposed to chemicals. Alright? So you can have issues like what? Asbestosis, silicosis, chronic bronchitis. So there's reduced lung capacity. So the way your lung is able to store a lot of air for you to breathe adequately is reduced. So you are basically weak, you are slower at doing work, and you are frequently ill. So hearing loss now. So long-term exposure to loud machinery. People that work in environments that, the machines, they produce a lot of noise, So, because the place is so loud, it affects your ability to be able to communicate with your next worker. This can lead to errors. Increased use of accident because most of those machines, they are big, they have moving bodies, so, can have issues. Reduce efficiency in team-based tasks. So musculoskeletal disorders, you are looking at all those repetitive movements, poor ergonomics, heavy lifting. So they can lead to all those carpal tunnel syndrome, back pains, tendonitis. So impact on work, you can actually limit mobility, cause a lot of pain, reduce the ability to be able to perform manual or precision tasks. So you can also have issues resulting from skin diseases, like contact with irritants, chemicals, and allergens. Okay, you can have all those dermatitis, eczema, chemical burns. So you can also develop cancers because of exposure to asbestos, benzene, radiation, and develop cancers like mesothelioma, lung cancer, bladder cancer. They have mental health issues. Like your environment is so stressful, you work for a very long time, poor management or exposure to trauma. All of this could actually make workers so anxious, so depressed, or burned out. Okay, so there's reduced work concentration and there's poor decision making, and the worker is there but is absent-minded. Okay, so there's lower productivity. So this is how occupational health can actually affect the work output of a particular company.